Welcome to Caucus, New Jersey. I'm Steve Adubato. You know, the United States healthcare system is in drastic need for change. But consumers also need to take more responsibility for their own healthcare. Here in the studio to discuss what we need to do to take better care of ourselves are Sharon Seitzman, President of QualCare Inc., Rich Miller, President and CEO of Virtua, Dr. Drew Harris, Program Director for Health Policy at the Jefferson School of Population Health, and finally, Assemblyman Herb Conaway Jr., physician and chair of the State Assembly Health and Senior Services Committee. I want to thank all of you for joining us, talking about population health. By the way, throughout this program, you're going to see a couple of websites that are going to be very valuable. Go on them, get more information. Population health. If you were defining it, Assemblyman and Dr. Conaway, why are we talking about taking care of our own health if, in fact, the government, the federal government, is changing? In January of 2014, I thought they were going to solve everything.
Well, look, you're not going to solve the problem of healthcare costs unless you take action to change the way people live. And that really starts with education at the youngest of ages. I was with a group of pediatricians just the other night who said, you know, much of what we see in adult life starts, you know, has its roots in childhood. You know, what's your relationship to exercise? What's your relationship to food? What is your relationship to your taking responsibility for your own health? Changing the dynamics there will have as much to do with anything we might do in terms of changing the horizon, the cost horizon of healthcare in this country.
Is that right, Rich? I mean, you and I have these conversations offline and on about public policy a lot. But is Herb right that we have so much to do with this ourselves?
Yeah, we have a lot to do with it, Steve. And I think, first of all, population health is a very large term. And I think it has to be broken down by community and by different populations. I mean, there's a population health in the inner city, which is a different community that you have to get more education and more nutrition support out to and have to reach them at their home. Different model than you would in a suburban community where maybe there should be more ownership by the population for their own health. And then there's the sick community where you have to manage chronic disease, where there's a high cost for chronic disease. So you're managing hypertension, you're managing type 2 diabetes, and you're managing a congestive heart failure. And these are the patients that typically come into the emergency department 4, 5, 6 times a year for care at a very expensive venue. We got to care for them at home.
But also employers. Sharon, we go back a long way, and our mutual friend, right, Annette Catino, who's a board member of the Caucus Educational Corporation, she's talked to us about this a lot as well. But in your company is one of the leading employers when it comes to leading this discussion. What is the role of employers in having their employees be healthier? Be specific.
Well, we talked about population and who is the population, and I agree with the gentleman that we have to break this down. But there's a lot of stakeholders. There are the providers, there are
Define providers.
Providers being the physicians, the primary care physician, the patient's primary care physician, specialists, the hospitals, other ancillary providers as being one of the stakeholders. The community is another stakeholder. The payers are another stakeholder. But as you point out, the employers have a big stake in this. When you think about the population, so many people get their health care paid through their employer. And it's a captured market. And it's a great opportunity when we talk about improving the health of the population. This is a captured market of people, a group of people, where you already have established ways of communicating with them and established support groups within an employer. So it's a great opportunity to get to the population or a subset of the population.
To do what?
To educate them about what it means to be healthy. For years, forever, we've been focused on, in healthcare, taking care of people who are sick. Now we have an opportunity to broaden that through the population and not just take care of the people who are sick, who enter the hospital or go to their physician or seek specialty services, but the population that's not yet sick, or the population that might be getting sick and they just don't know about it. So if we can educate them about what it means to be healthy, or what are the signs and what are the key risk factors that they should be focusing on to avoid getting sick. And
true preventive care.
Dr. Jumpman.
Well, I think it's important that people take ownership of their health. But there's a certain concern that I have that we can be doing victim blaming. Because
Victim blaming?
Yes, because if somebody is unhealthy, it may not be entirely their own fault, or we could be doing things in our communities to help make the healthy decisions the default decisions.
For example?
Well, for example, like making sure that trans fats are not in the foods, which is what they did in New York City, to try to make sure that when you go out to eat that you're going to get healthier food, or that you have access to fresh fruits and vegetables.
So hold on, time out.
Sure.
So part of this is what you can do for yourself. Part of it is public policy. Part of it is what employers do, et cetera, et cetera. But Mayor Bloomberg, as we do this program, who gets lambasted by some for saying, hey, wait a minute, how much soda do you really need? And he starts a discussion about it. Your view is what your view is on this issue. But if his concern is the public health of the people in the city, is that not part of population health in New York City?
It's a very important part of it. And it should be an important part of what we're doing here in New Jersey. We need to make conditions where people can make healthy choices. And if it means you go out to eat, maybe I don't want all that salt in the food. So I can add it if I choose to, but I don't want to have salty food to begin with. Try to make it easier for people to take advantage of walking opportunities in their communities. I live in a neighborhood, my backyard is literally a park, but there's no sidewalk connecting the two. Why was it designed that way? I had to walk almost a half a mile to get into the park instead of going through the woods if I wanted to be safe on the sidewalk. So my kids couldn't take advantage of that in the way that they should have been able to. Well, there's lots of communities how we designed it. Even you go into a building, and the first thing you see is the elevator instead of the stairs.
Right.
Maybe we should put the elevator around the backside for those who really need to use an elevator, unable to climb stairs, and for someone who needs to go to the first floor, make those stairs easy to get to. Simple changes are going to result in significant improvements in health.
Jump in.
Yeah, I want to, Steve. And to Drew's point, too, I think the key here is that employers can make a big difference. You know, you talk about everybody's in this game together. You know, in our cafeterias, putting calorie counts out in front of food.
What does that really mean?
What that means, people, when you have a piece of fried chicken and a piece of baked chicken in front of you, what's the difference in content of sodium and calorie? People should be looking, that's how you start educating your employee base on what's healthier to eat, doing portion control appropriately. Next year, maybe when I take the deep fryers out of my cafeterias, which I'm contemplating for employees, is to say, you have to eat healthier now. But it's a step-by-step education process to help people understand why we're taking these steps.
Devil's advocate, before you jump in back in, doctor. Say you were to do that thing that you said you were considering.
Mm-hmm.
Is there a part of you, Rich, that says, because you're very close to your employees, they've been around your place long enough to know that you walk the halls, they've seen the relationship you have. Is there a party that says, hey, wait a minute, I want to give them the choice, and I'm not looking for them to get angry about this, I'm just concerned about their health, and that you struggle with that question of how much of it should be their choice and how much of it, we're just not going to give them the choice. Do you struggle with that?
I don't, and I'll tell you why I don't, Steve, because we have started a 2-year campaign of education with our employees about health and wellness. We're giving them choices up to now, and the problem we see is the incidence of chronic disease and the disease that's on the horizon is out there. We look at our employee population as not a healthy population. It's not. We know it's not.
Employee population.
Our employee population, when we measure, because we're doing health risk assessments on our employees, and a lot of people have taken advantage of doing them to find out what their risks are.
They want
to do it. Most people want to do it. It's
and
amazing.
When they find out
right,
that they are not as healthy as they thought or they wanted to be,
they look for more education on how they become healthier.
And you don't let them smoke there.
No. So it's smokeless. Yeah.
It's not like you have a choice.
No.
Well, you can, these things have a payoff. And where employers have aggressively sought to improve the health of their population, they see it in increased productivity and they see it in decreased healthcare costs. And so these, having a lot of choice is not always the best thing.
So it sounds great. Someone says, give them a choice.
Parents know this in their home. If you always allow your child to choose between items, one, they're not going to eat everything they should, and two, they're often going to eat things they should not. And the same thing in the workplace. Taking the fryers out, a couple of people will gripe, but everybody will accept that and understand they're going to get a nice lunch, healthy lunch, and it's going to be better for them in the long term. Education is the key. That's why I fought to have and passed a bill to have nutritional standards in schools.
You mean as a legislator?
As a legislator, because government can have an impact here. We haven't won this one yet.
Nutritional standards in schools.
In schools to make sure that kids in school get healthy meals when they're in school. They get a couple of meals a day in school.
Don't give them the choice to have chips and soda.
That's exactly right. And take those things away. Make sure you have, we dealt with the soda in schools and other high-fat things to get them out of the way, candy and other things. And, we as parents and the schools need to look at, and in hospitals, by the way. When I was, a resident, as I walked around the floors, there was always somebody getting married, somebody, coming back from getting a baby. Cake, everybody bringing food from home. They didn't want it home, so they brought it into the hospital. And, you stop, you have it, get to a floor. You could eat all day. And so, when you have a hospital system saying our employees are not healthy, it's because there's a lot of food around. We have too much access to food, too much choice, and it's time to step back, to begin the education process, and to make people think all the time, what am I doing here with this food item that's in front of me?
But again, Drew said you got to make it accessible. Sharon, and then I'll come back to Drew. Go.
I agree that going back to the employer being a contained group of people where you have access to educate, and education is critically important. And we're seeing, as Rich points out, as an employer, QualCare as an employer, and what we do, we administer the benefits for health benefits for employers. So we're working with them to support them in developing wellness programs. And one of the things that we see is it's not an overnight process. You've got to take time to educate the employees. And once they are introduced to certain programs, healthy choices in the cafeteria or walking path on the campus, they start talking about it. It's a support group. There's a Weight Watchers program, or there's a fitness challenge that they could do together. The education process allows them to think about their own health. And then it doesn't stop there, and I think this is an important point too. We were talking about the community and how important it is, and what the mayor did in New York. It's important for whatever the employer does within his organization, it could be taken away if you don't have the support in the community behind it. So it's critically important, not just what we do as employers, but to make sure that the communities, that the employers send out their employees to their own backyards and their neighborhoods and their communities, and they have the support and resources there. So there has to be a lot more done in terms of collaboration between the employers and what's happening out in the community.
Jump back in, Drew.
Yeah, let me tell you a story about a patient of mine that had actually had diabetes and suffered from severe kidney disease. Actually had 2 transplants. And one day he's in my office. He's saying to me, I said, "So what are you doing tonight?" He said, "Oh, we're going to go out to dinner." I said, "Well, where are you going?" He says, "Well, the all-you-can-eat buffet." I said, that food is fatty, it's salty, it's high. You tend to eat more of the really bad food. I said, you should be eating healthier. And the guy looks at me and says, "Doc, for $9.99, I can get a full day's worth of food. I can't eat that cheaply at home." So the question is what are we doing in terms of our public policy that makes the bad food so cheap and the good food so expensive? And if you look at the data, you'll see that relative to our purchasing power, bad food, the high fructose corn syrup, all the things we talk about, we're telling people not to eat, has gone down in price, and the broccoli and the cauliflower and the things we should be eating, the healthier foods, has gone up in price.
Why do you think that is?
Part of it is U.S. farm policy. What we do as a society in terms of supporting, we subsidize corn. That's where high fructose corn syrup comes from. We don't subsidize broccoli. And so until we begin to change the incentives, people are not stupid. They vote and they make decisions on what's in their wallet, and especially low-income people who really don't have the luxury of being able to buy the more expensive Whole Foods kind of food. Instead, they have to go to the place where it's
They don't
cheaper.
have access to a supermarket very often.
Supermarket deserts, as we've talked about. Let me ask you, do we run the risk, and listening to Drew here, do we run the risk of having a situation where, as we talk about, we call this program population health, do we run the risk of having the disparity, the chasm, if you will, between the health of those with means, those with better education, those with greater access to fruits and vegetables and exercise and information about their own health, who get the screenings and then go, wait a minute, my cholesterol's high, my blood pressure, my weight is, my body fat, I got to get this under control. And then access to fitness, et cetera, et cetera. Do we run the risk of it just becoming greater and greater in light of what you just said?
Well, I think we do. I think there is that risk, Steve, but I also think, again, for different sets of population, we have to start in a different place. I really believe that.
But where you are down there, you have a suburban population you serve, but you also have
the Camden population.
Yeah, that's my point.
Yeah, and we serve the Camden population.
You serve them differently.
Well, the needs are different. I mean, for example, the Camden population, their needs in terms of health care, sick care, is different.
Yeah, but they don't have excuse me for interrupting, do the food desert thing. It's not like you're going to put a supermarket there. So it's
Well,
like...
Well, there is
coming,
one coming to Camden.
Why not?
Yeah, ShopRite's coming to
Finally, yes.
Camden.
Finally.
Finally. We're getting
like that,
ShopRite.
explain to folks how big a deal that is.
That's a huge deal. Herb probably knows it better than I do. It's a big deal in terms of the city getting to get fresh vegetables and food. That there is no inner city marketplace. We have a produce market in the summer from May to October in front of our hospital with fresh vegetables and fruits that people can shop. But there is no place for them to
It's
shop.
not a year-round...
It's not a year-round.
So even if you educate people on what to do and getting this idea of
They got
cars,
to find a place to get it.
Right.
how do you get it? And that's
Right.
why this investment and making sure there's a ShopRite in Camden and other places where there are these food deserts. It was only a start though, because that's where the community and why this
Right.
concept of public health, population health comes in, because you really have to get down to the community level, do the education, and let people know that there's an opportunity for healthy eating.
P.S. The Robert Wood Johnson Foundation is doing some work in this area. We've done some programming, only scratched the surface in this area, and I know they've done some, particularly in New Brunswick. They've made some progress there, but go ahead.
Yes. So first of all, when people can't make those decisions, we tell them to do the right thing, and then they can't do it. We shouldn't blame them for it. That's what I was talking about with victim blaming. But there are Philadelphia, for instance. They're not putting supermarkets in. What they're doing is working with the local grocery stores
Yes.
where people are already buying it and setting up very nice displays with fresh fruits and vegetables that you would want to eat,
Yes.
and not putting in the back of the store, but right out front where the kids come out of school, instead of buying a soda and a candy bar, they're going out and being encouraged to buy an apple, a banana, or something else that is healthier for them, and working with the grocers to make sure that those options are available to
Let me ask
people.
you this, what about the exercise piece of this? Because I always wonder how much of this is personal. Herb and I actually were having a conversation this morning about our own personal exercise routine. You and I have talked about this before. I know that this is a big part of your life. You know, and I don't say this for any other reason other than the fact that I'm trying to incorporate it into the program. For me, to do what we do, we tape a lot of shows, like 10 half-hour shows in a day, and it's just, that's how we're cost effective. To have the stamina to do what we do, a lot of people around here, I mean, I could not imagine doing this without exercising early in the morning. But it's not as if our employer says, public television says, you should exercise in the morning and you should eat right. And it's because that's what you do to be healthy enough to do what we're doing here. And I know that everyone here does what they need to do. My point is this, it's a long-winded way of getting to the question. When it comes to exercise, isn't that a personal decision that you say, I'm doing this? You've been doing this for a lot of years. That's your decision.
It is, but there is an opportunity, whether it be through the community or through an employer, to educate people about what are modifiable behaviors that will prevent them from being at risk.
Get that down to the ground level.
So what that means is educate people on what are those activities, what are those behaviors that you can change. So inactivity is one of those modifiable behaviors or behaviors that you can change to improve your health. Not smoking is another a simple, basic behavior that you could stop or you can change to improve your health. So yes, it is personal, and everyone has to make their own decisions. But when you go back and you think about the employer and them educating people about what are those, what we think are obvious behaviors that can improve our health is not so obvious to the average
Is there a
employee.
responsibility sorry for interrupting, for employers, listen, with this economy, I can't believe I'm saying this, but is there some responsibility for employers to say, you know what, in the effort to have our employees be healthier, we need to consider the prospect of the investment of putting a facility, a fitness facility in our facility.
And it pays. It pays off to do that.
Because A, it's more accessible. Right. B, if we didn't do it, it would be harder for our people to exercise given the travel and everything else.
But you know,
but here's what really works though, is when the boss...
And then you don't mandate it, but you make it accessible.
But when the boss goes into that facility and takes time out of her day to go exercise, that sends a signal to everyone who works for her that this is something that really needs to be done. Same thing, if a doctor wrote your prescription, instead of for a pill, wrote your prescription, says, I want you to go down to the Y and get a free first visit, and there are these programs that out there.
And it's been shown to work.
And they really do, and they encourage it. And the other thing is the social network. We know that when people quit smoking, it's not just an individual decision, it's a whole group of people, including people they may not even know who quit smoking. This whole social network theory. When you begin to change one person, you begin to change many others, ripple effect. And that's what we're doing in our communities, and that's how we're going to get more people to exercise.
Let me jump in on that, Steve, because part of it too, and I think the problem we have in educating people about exercise is that they have to go sweat for 2 hours in a gym every day. What we talk to our employees about is go out and walk. Walk 20 minutes, walk a half an hour. It's simple as getting moving. And we do this with walks with our people all the time around Virtua to make sure they're out.
What do you mean walks? Like, where are they going?
Walk. We have office complex where they can walk around a lake. I encourage them at lunchtime to go out even for 20 minutes and walk around and just get out in the air and exercise. It's moving. If you think, you and I were talking about this with Dr. Steve Altschuler at CHOP, 20 to 30% of kids at age 4 are obese, morbidly obese. Think about those numbers. I mean,
let me ask you, do you see yourself, because I'm going to go back to what you said, Doctor. Yeah. Do you see yourself as the CEO down there as some sort of role model?
Yes.
You do?
Yes.
Yeah, look at him, he looks great.
Yeah, whether it's, we have 3 fitness centers where we have a lot of employees enrolled because we discount the fitness center charges for them dramatically so they get involved. But also, I go to the lakes, and I go to the buildings, and I walk with the employees. So I am a role model for them. And I want them to know that this is what we want them to do. In fact, I think Drew said it, we encourage them, to get outside, take that time out of your day, even if it's on the work time.
But talking, again, encouraging and talking about it is one thing, doing it's another, because I know you do as well.
Yes, we do, and I just want to add to that, because we're talking about a fitness center, and Virtua has the opportunity to have fitness centers on site. It doesn't have to just be a fitness center.
What else could it be?
To Rich's point,
like walks,
educating people to take a walk at lunchtime.
Yeah, that's right.
When we talk about the workplace, we're talking about large employers with thousands of employees, but we're also talking about the small employers that might have about 15 employees, and they too could put and encourage their employees to think about wellness and think about fitness, and instead of spending a whole hour having lunch, you could have lunch for 30 minutes and go and take a walk for 30 minutes. It's encouraging the employees, but I agree with what everyone else is saying. It's critically important in the work site to start from the top and make sure that it starts from the highest level to build that culture of wellness.
And that is a good point about the fact that it is the cumulative exercise that you get. So you can get your exercise in parts, and it's just as effective if you've got all the parts at once. But in public policy, again, how we build our communities. Do you have sidewalks? And of course, then the population health question and the various components that are in. Now, the parent says, I don't want my child in the neighborhood, it's not safe. Yes. Now you've got to get policing, you have to deal with the social factors so that you can so parents can say, get outside and play in the playground, which I was told to do. I think of my own children being driven to their sports games. I had to ride my bike to go to the Little League or go wherever else, and then my parents would catch up later. We rode everywhere. We walked everywhere. It was safe to do that. A lot of people live in communities where it's not safe to walk on the street, and that impacts their health. They're sitting inside playing a video game and getting fat.
Got a minute left, and I have to put this out there. I have to be fair. What about anyone watching who says, wait a minute, I have 2, 3 jobs, if they're lucky enough to have that, because they have to have it. What are you talking about? I got 2, 3 jobs. I'm trying to keep it together. You're telling me I have to take care of myself.
Well, that's where a minimum wage comes in that we fought for. Some of us fought for.
I knew you'd get political.
But it's true.
I knew you'd get political.
Because that does have an impact. It has an impact on your ability to deal with your health. If you're working all the time, then that's less. I mean, you only have so much time in a day.
Right.
So if you're working, running around, scrambling job just to make ends meet.
Can we do that on Capitol Report? Our other show.
No problem at all.
I want to thank all of you for helping us get healthier. It is a long process, but you've got to start somewhere, and there's no quick, immediate solution. Thank you all very much. Great job.
Thank you.